Mr. Levin.
I now yield 2 minutes to another distinguished member of our committee, Mr. Kind, from the great state of Wisconsin.
Gentleman from Wisconsin is recognized for 2 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I thank my good friend from Michigan for yielding me this time for his leadership on this issue. Mr. Speaker, just to address the previous speaker's comments, if you're a small business in America with 50 or fewer employees, you don't have to do a goddamn thing under the Affordable Care Act other than receive tax credits for offering health care coverage to your employees. So let's stop this nonsense of trying to scare small businesses throughout America. It's been pointed out on the floor by numerous colleagues this is the 31st attempt in this session of Congress to repeal all or part of the Affordable Care Act. Even the Washington Post pointed out earlier this week that Baskin-Robbins only offers 30 flavors of ice cream. Enough is enough. And when I first heard that the United States Supreme Court upheld the constitutionality of the Affordable Care Act, my first feelings was relief and happiness. Not for me or anyone else who was involved in advancing the cause of health care reform, which was desperately needed. It is a system that has failed too many Americans for too long. But it was happiness for a one-year-old little boy who I had a chance of meeting back home in western Wisconsin by the name of Henry. See, Henry's mother informed me that before he was even born, he suffered a seizure in her womb. And therefore, the very first breath he took in his life, they were informed that he was uninsurable because he had a pre-existing condition. And that family was depleting their entire life savings, making sure that Henry was getting the health care treatment that he needed to survive in his life. We're better than that as a nation, folks. An Affordable Care Act, as this family pointed out, changed that immediately for Henry and that family and for 39,000 other children throughout western Wisconsin who have a pre-existing condition. 45,000 young adults in Wisconsin now can stay on their parents' plans because of this act. Seniors in Medicare get a 50% price discount for the prescription drugs that they need in their life. You want to talk about a big tax increase? Take away the 35% tax credit that small businesses are getting today for providing health care coverage, which goes up to 50% in 2014. Or the $800 billion in tax credits that individuals and families will receive under the exchange so they can afford health care coverage.
I yield an additional 30 seconds.
Gentleman is recognized for an additional 30 seconds.
Let's talk a little bit about that tax increase that people are going to be facing if they're successful in repealing this legislation. What we need is for more cooperation and more effort in reforming a health care system that is complicated. It is too expensive. And we have tools in place now in this legislation that will not only enable reforming the way health care is delivered, so it's more integrated, coordinated, patient-centered, but how we pay for it. So it's based on the value or quality of care that's given and no longer the volume of services that are rendered, oftentimes with poor results. I encourage my colleagues to vote no on this, and let's work together to improve a health care system that's in desperate need of improvement. I yield back.
Gentleman's time has expired. Gentleman